Hello, my name is Melinda, and I am presenting on estradiol effects on the severity of acute pancreatitis in overectomized mice. I am presenting on behalf of Dr. Gorlick's laboratory at Yale School of Medicine. Serum estradiol levels on hospitalization admission predicts acute pancreatitis mortality, perhaps better than other biomarkers or calculators. However, little research has shown whether E2 directly increases acute pancreatitis severity or simply correlates with worse acute pancreatitis. Therefore, we hypothesize that estradiol treatment would increase acute pancreatitis severity in overectomized mice, or female mice with their ovaries removed. In our experiments, overectomized mice were treated with 6 hourly injections of cerulin and then euthanized for tissue collection after 6 hours. For some mice, they were also treated with a subcutaneous injection of estradiol 1 hour prior to pancreatitis induction. The pancreatitis responses we analyzed included serum amylase, pancreatic edema, histology, neutrophil infiltration through IHC, electron microscopy, and immunofluorescence. Control overectomized mice were compared to mice treated with cerulin with and without additional estradiol treatment, and there are about 4 to 6 mice per condition shown here. First, we found that on electron microscopy, overectomized mice seem to have an increased amount of acinar cell ER stress compared to female mice, as you can see here and here. Additionally, the cerulin-treated overectomized mice who also received estradiol treatment seemed to have a decrease in edema compared to overectomized mice without estradiol treatment, and a decreased amount of amylase, suggesting potentially a decrease in pancreatitis severity. However, we also found that these mice treated with estradiol had an increase in trypsin response after 6 hours and a trend towards a decrease in neutrophil infiltration at 6 hours, which could potentially suggest a worsening in pancreatitis severity. Therefore, it seems that estradiol seems to have a selective response in acute pancreatitis severity in overectomized mice treated with cerulin. We also found in the estrogen-treated mice that these mice seem to have an increased number of these eosinophilic structures, some of which are homogeneous, others of which are not. On immunofluorescence, we found that these structures, which are about the same size as the nuclei, also showed up when staining for trypsin on immunofluorescence and for amylase. On electron microscopy, a similar structure about the same size as the nucleus was also found to include zymogen granules suggestive of zymophagy. These studies suggest that there is an increase in zymophagy in mice treated with estradiol within these studies. Therefore, we summarize that estradiol affects both neutrophil infiltration and acinar cell function through zymophagy in acute pancreatitis mice treated with cerulin. However, as shown by the initial control slides on electron microscopy, overectomized mice is a complex model to use, and the act of overectomy itself may cause underlying changes that affect the pancreas's response to both inflammation and estradiol. So further assessment is needed to assess the effects of overectomy itself on pancreatitis and estradiol responses. We conclude that with these studies, estradiol does seem to have a selective increase in acute pancreatitis severity in overectomized mice. Thank you, and I will take questions at this time.